Welcome back. My name is Jim Guarino on Afd-Tv, and I have the privilege of hosting Dr. Sam today on his own show.
Great. Thank you, Jim.
Dr. Sam, it's become to my attention that you are clearly a very special physician, that you seem to be on the forefront because you understand prevention and wellness, nutrition, and that type of looking at your health differently than perhaps maybe some of the old school. Would that be safe to say?
That's a great question. And going back from what the word doctor means, it comes from the Latin word docere, which means to teach. And way back then, there wasn't a drug for everything. There wasn't a drug for blood pressure, for cholesterol, for sleep, for pain. Doctors, our main job was to help teach patients to take best care of ourselves. Now, the good news is I really believe the pendulum is swinging back. One of the big reasons is, number one is, who wants to be in a wheelchair and to have lots of chronic issues and be on lots of medicines, but the other big question is who's going to pay for it. Health insurance now does not cover as well as when I started as a doctor even 15 years ago. Health insurance covers patients as well as a hospital gown in a snowstorm in Michigan. And you may think you're covered, but you're not really that covered. A lot of patients, including myself and my family, have went to the high deductible plans, the health savings accounts, which is great. It covers physicals, it covers wellness, it covers vaccines, and that's it. It has a $6,000 deductible, some prescription allowances, but it's not cheap to buy prescriptions. And so the goal with these plans is to take care of ourselves as best as we can so we don't end up overutilizing the system at the cost of our own health.
So really, it's kind of turned itself around. People have to be more aware and learn how to take better care of themselves. And what you're saying is that you feel part of your job as a doctor is to be teaching them how to do just that versus just relying on you.
Definitely. I mean, my interest as a physician is not to just see patients for refills for blood pressure medicines and sleep aids, and pain medicines. That's just not fun. I mean, I will refill medicines, but my goal is, as much as possible, to get people off, to be on as few medicines as possible, and if we're lucky, to be off all medicines.
That would be just as probably more rewarding, I would imagine.
Much more. There's plenty of sick patients out there, and we're blessed and plenty busy, so that's good news. What gets us out of bed every morning is to actually make a difference, and to make a difference in our world and our community. It starts one person at a time.
The preceding advice provided in this video is informational and strictly the opinions of Dr. Sam Yadrala and AFD Clinics. For a more accurate medical opinion of your personal health, please consult your primary care physician or visit one of AFD's clinics today.